Fibroid symptoms and treatment. Do you have heavy periods? Do you feel discomfort in the tummy area? Perhaps you've been diagnosed with fibroids. Or maybe you haven't been diagnosed with fibroids, but your period is heavy. And maybe you are curious that it might be an issue for you based on what you've searched on the internet. So let's discuss the symptoms of fibroids and the treatment in this Facebook and Instagram Live. Hello, I am so thrilled to be here. For those of you that don't know me, my name is Michelle Cooke. I'm a period and hormone naturopath. I'm also a natural fertility educator and an emotion release technique practitioner. And I help women struggling with their menstrual cycles have easy, pain-free periods, balanced hormones, and emotional well-being. And I'm the founder and director of a clinic called Reproductive Wellness, and I see patients both online and face-to-face. So if you have any questions or comments as we go through the live, or perhaps you're watching the replay, please pop them in the comments box down below. I would love to answer them for you. And just hit the likes and love hearts if you're enjoying the content as well. What are fibroids? So uterine fibroids are benign, which means non-cancerous, growths in the uterus. Or sometimes they refer to them as benign tumours, so they're not cancerous, but they're a type of growth. It is estimated to actually impact 1 in 4 women, typically under the age of 50. The size of them can be variable from woman to woman, and the growth of them is estrogen dependent, and they tend to be fueled by particular phases of the menstrual cycle. So particularly in the follicular phase, for example, the phase that's prior to ovulation, that's when estrogen will typically be higher. It starts to rise during that phase. So that's what sort of fuels the growth of this estrogen-dependent tissue. Types of fibroids. There are 5 different types of fibroids. Sometimes when you're looking online, they only list 4, but there actually is a 5th one that isn't always mentioned. So the first one is intramural fibroids. So these are the most common type of ones, and they're found within the muscular wall of the uterus. Number 2 is subserous or subserosal fibroids, and these grow on the outside of the uterine wall into the pelvic cavity, so it's kind of stuck on the outside. Then the third type is submucous or submucosal fibroids. So these ones are attached to the uterine wall, and they're protruding into that uterine space. So kind of the opposite of the subserosis, it's protruding to the inside of that space. And apparently these are the most likely to have heavy periods or menorrhagia associated as a symptom. Then there's pedunculated fibroids. So these are attached either on the outside of the uterus or the inside by a stalk. So they almost look like a little lollipop. So if you can imagine, there's the stalk, which is the stick of the lollipop, and then the round part is the fibroid. Now, the 5th type that's not commonly talked about, and it's not really a common one either, it's a broad ligament fibroid. So this is located in a structure that's surrounding the uterus. Fibroid symptoms. So some of the symptoms will actually depend upon where they're actually located, how big they are, and which areas they're actually protruding into. That makes sense, right? asymptomatic, so there might be no symptoms. So you might have fibroids and not even know. And this is typically the case when they're smaller in size. However, there are people that have small fibroids and they have symptoms. So everyone's different. Menorrhagia, so that is a technical term for heavy periods. So this is the most common symptom that I see coming into the clinic. And it's when we have to remind ourselves, well, okay, what is a heavy period then? So a heavy period is when you're losing more than 80 mils of blood over the whole duration of that period. And you might be changing your pad sort of every 1 to 2 hours. So there's frequent changing because there's flooding there. Or you might actually be bleeding for longer than 7 days. That's considered a heavy period as well. Then there's metrorrhagia. So that is sort of abnormal bleeding that's occurring outside of your period. So that's also known as intermenstrual bleeding as well. So that's another name for it. Feelings of heaviness, discomfort, and pressure around the tummy area or the abdomen, particularly if they're larger in size. There's a lot more pressure there on the body. Enlargement of the tummy as well is a symptom that could be possible, or abdomen area. Painful sex is another one. Low back pain or back pain generally. Pelvic pain as well. Constipation, and this would typically happen if there is pressure on the bowels, because remember, it depends where they're located. Feeling like you have to wee all the time, so there's an increased urinary frequency, and that's particularly if there's any pressure on the bladder as well. So fibroids treatment, obviously there's a bajillion things that can be done here, and that's really where natural medicine shines in terms of diet, lifestyle, even looking at testing and seeing what nutrients are deficient that may be contributing to the fibroid growth, the proliferation, so how many of them there are, and things like that to sort of modulate them, and what your liver's doing, what your gut's doing. There's lots of different things that can be addressed in terms of fibroids, but today I'm going to give you 2 tips to take away today. So number 1, so switch period options. So if you're currently using commercially available pads and tampons, you really need to rethink these, because sanitary items that are non-organic contain a wide array of chemicals, and these chemicals are known as xenoestrogens. So xeno stands for foreign, so it's a foreign type of estrogen, but your body is none the wiser, so it can actually come in and cause a lot of signaling issues and estrogen dominance issues and problems there, and the body, it just doesn't even realize. So remember, a fibroid is typically the growth of it is driven by estrogen, so don't forget that. So it's not good news when we're talking about those chemicals acting like estrogen. Of course, it's going to create issues. So the kinds of toxins that they contain are things like dioxin, which is a byproduct of chlorine bleaching. So they bleach tampons and pads because they're made of wood pulp, which is brown in color, and that might look a bit icky and undesirable to someone that's using a pad. So if it's white and clean looking, it looks a lot better and a lot kind of desirable to use. Synthetic fibers is another thing that's in there, and phthalates, which is a type of soft plastic. Petrochemicals is another one. And there's a high risk of genetically modified cotton being used as well. So that's also an issue. Pesticide residues, so this is when cotton itself as a crop is very heavily sprayed so that's an issue. Then there's synthetic fragrances added as well to make it smell nice, and all those types of things. So what should we do here? So what we need to be doing is actually switching to organic pads and tampons if that's your choice for your periods. So you can readily get those at the supermarket. If you're based in Australia, you can get the Tom organic brand, and that's a good one to go for. Or we can go for organic period underwear as well, or a cup if that's your jam as well. So whatever you're using there, switching to those to reduce that xenoestrogen exposure. Turmeric for the win. So turmeric is a wonderful way to use food as medicine. It is an antioxidant, it's anti-inflammatory, it assists with phase 2 detoxification, which is extremely important in estrogen balancing in the body, and supporting the clearance of toxins, because we're exposed to them on a daily basis, whether we're aware of it or not. So there is a study actually that shows that it can actually inhibit the proliferation of fibroids, so the amount of them. So that's pretty amazing, isn't it? So you're probably thinking, well, how do I incorporate this in? Do I use fresh? Do I use dried? What can I do there? So one option is you can drink turmeric lattes. So a good brand is Golden Grind, or Tea Elixir make a mushroom turmeric latte. So this one has cordyceps as well, which is a medicinal mushroom that's really, really good for energy. They're typically available for those of you that are located in Australia, or you can actually make your own, but make sure that you don't just put turmeric into milk and be done with it, because it will taste a little bit like a curry drink. So make sure you're adding spices to it. You can get ideas from those brands as well on what spices you can add. Add a little bit of honey, and you can use either dairy-free milk or goat's milk or whatever milk you like. Another option is you can add it to your cooking. So either freshly grated or the powder is fine. So you can add that to curries, stir fries. You can sprinkle it on roast vegetables, all those types of things. So just get creative on how you can add that in. So those would be my 2 tips. Obviously, as I mentioned, there's a lot of things that need to be tidied up in terms of fibroids, but they're 2 good actionable steps that you can take away today and implement straight away. So if you would like help with your heavy periods, perhaps you've got fibroids, or maybe you're thinking maybe you do have them potentially, I would absolutely love to help you. So if you're watching on Instagram, there's a link in my bio. If you're watching on Facebook, I'll put the link down below for you. And if you're watching on my YouTube channel, there is a link in the description for you. So just go ahead and follow those. So remember that all my Instagram and Facebook lives are actually all on my website. So if you go to reproductivewellness.com.au/blog, they'll be all there. So I've got the video at the top and all the written description underneath for those visual learners. So go and check those out. And I will be here every Wednesday evening. I've changed the time. I've made it 6 p.m. So at the moment it's Australian Eastern Daylight Saving Time, but typically it will be Australian Eastern Standard Time. And I'll be talking about things related to periods, menstrual cycles, hormones, and all those juicy things, and women's health, of course. So I really look forward to seeing you next Wednesday night, and I wish you a very lovely and pleasant evening, and I look forward to seeing you next week. Thank you so much for watching.